Okay, one of the reasons I felt so strongly about opening this clinic with you and supporting you and providing this service is because of my own experience with you as a patient. So, for those that don't know, you've been treating me for almost 8 years now. Mm-hmm. And because I'm your sister, I had direct access to you. So, anytime I experienced, I would take a medication that you prescribed, or in this case, a bioidentical hormone that you prescribed, and my reaction to it would be strong. I'm very sensitive to medication, and I'm very aware of my body, so I was noticing changes, and I was able to communicate those to you immediately and in real time, and you were responsive to me, and over the years, I think that has, remained true. We just really communicate regularly, and because of that, my experience has been so positive. I mean, I think that's one of the main reasons my experience has been so positive. The other is I had a lot of questions initially about, how this looks long term, how you manage my care in particular based on my symptoms, and I was able to have extensive conversations with you about what it means to be on hormone replacement therapy, what kinds of things I was looking for, what does it feel like to be optimized, And one of the things that we talked about a lot is the blood work. And so I would get regular blood work and I would see the results, and I would see that my blood work, it's like red and green on the blood work. It shows your results. It shows if you're in the red, you're not normal, so to speak. And if you're in the green, you're doing what you should be doing. And we would go over those line by line because I was neurotic about them. And you explained to me, which I think is really important to share with our community, why you can't compare yourself to the levels that are considered normal in a normal blood work or a normal laboratory report. And so maybe you can talk a little bit about why that is and why what you do is so distinct from a traditional medical practice where you would just kind of gauge one's health based on the normal levels in a Quest lab report.
Yes, so I think that it's two things when it comes to blood work. First, the reason that I don't like to necessarily trust what's normal on a laboratory report is those numbers that they create, the ranges that they create that are so-called normal, are created through like market research, essentially. So they take, the status quo amongst the population and then create a bell curve, and that's how a reference range is created. And so if you look at the average American, you're going to see, and most of people, if they're in the health and wellness space, know that the average American is actually not healthy. And so the results are going to be skewed towards a not healthy person. And that's what's considered normal because that's the average American. And so that's why I don't like to compare my patients to normal, because who wants to be that normal? That definition of normal is not something that I want. So I don't want it for my patients either. And so that's one of the reasons that I don't fall and keep my patients within the quote-unquote normal ranges. Second, I think that when I look at the laboratory, I am looking at you as a whole person. A lot of the physicians will look at each individual laboratory kind of as an island of itself. So kind of like separating you by systems. So heart system, kidney system, muscle system, however you want to explain it. And then is it normal for that system by itself? But if you look at it in conjunction to the whole body, you might start to see trends and patterns that indicate that the whole body is not quite optimized. So a perfect example of this would be something like insulin resistance. You'll see it not only in the blood sugar, which is part of a chemistry, but you'll also see it in the cholesterol, as well as maybe liver function. And you can also see it with how much like muscle mass a person has in their body composition. So I think it's really important to look at the whole blood test as a whole rather than breaking it down into these individual minute parts.
Yeah, and I think that's one of the reasons you stand out to me as a practitioner is because you've been focusing on hormones almost exclusively for the past, near decade. Mm-hmm. So you've seen hundreds of patients in the urology space, but also in the hormone space. And they have, so you've seen 100 different laboratory results. And I'm, obviously 100 is a fraction of the number of patients you've seen in that time. But, and so over the course of that time, you're acquiring knowledge about what it means mm-hmm. to feel amazing, what it looks like to feel amazing. And also what I noticed too about that is that it's so symptom driven, this practice, right? This
Exactly.
type of treatment, I guess, if you want to call it that. And so in order for you can't just look at a static lab results, right? You have to combine that and all of your years of experience and all of your interactions with all of these different patients with what it looks like to feel good and what it looks like to feel bad with this particular individual symptoms. And I think for me, that has been my experience. I have had normal lab results on, for the most part. I have a couple things that are always a little off, but for the most part, normal lab results this entire time.
Correct.
But I didn't feel good. I wasn't able to. I was having sleep interruption. I wasn't able to maintain my muscle mass, even though I was working out like crazy and lifting and doing all of these things. And I was experiencing anxiety and depression. And instead of resorting to what I had done in the past, which isn't a bad thing, just didn't feel like I was living my best, most healthy life. With antidepressants and anti-anxiety medication, you started, helping me to explore how hormones played a role in all of those symptoms. And it's evolved a lot over the years, right?
Yes, I agree.
And how would you compare that? How would you compare my experience to a typical patient experience for you? How do you approach kind of fleshing that out with someone who's not your sister?
Yeah, it's been really great having you as kind of like my first guinea pig because we've had this symbiotic relationship where I treat and then you give me feedback. And it's helped me to be more sensitive to each individual patient. So for example, if I just arbitrarily started someone on a medication that was 100 milligrams and that was just typical starting dose, with you did not work. Mm-hmm. It was very uncomfortable. So now I'm more mindful of that. And even though I think the person on average, say 90% of the time is going to do fine at that 100 milligram starting dose, I might start someone on 50 milligrams and then just, maybe titrate them a little bit quicker if they're doing okay. But then that way they have a positive experience with that hormone because we started them slower. So it's been great in that sense because it's helped teach me from the patient perspective how to better relate to them and to truly listen to every little, even though that's like, in my mind, from a physiologic standpoint, that doesn't make sense. It shouldn't make you feel that way, but it is. So trusting the patient, trusting what they're feeling, and then using that as a way to manipulate maybe the combination of medications or lifestyle modifications that we've talked about to help them feel better and then go slower. I think that's giving my patients a better experience because I'm more willing to not feel like I need to be in control of how this looks, that the patient can teach me how it's going to look for them as an individual and not stick to some specific algorithm that I may have been taught. So I think that's been so wonderful to have with you because you taught me how to do that.
Yeah, and I really appreciate that. I think about you. I think in my experience, we've talked about this before. I'll read something in a book or I'll see something on Instagram, like the newest thing about estrogen or a dosing that, a testosterone dose or something like that. And I'm like, I want to try it. And because even though I trust you implicitly to guide me in my overall health journey, sometimes I want to take ownership for my own health. And so I'll do my own research and I'll acquire my own knowledge. And the thing I appreciate about you is you always go, okay, let's try it. And sometimes you'll tell me, well, these are some of the side effects of that, or these are some of the consequences of that, potentially, like estrogen cream, for example. And you warn me. And then when I experience that or something else, we just adjust. So having that, I can't imagine doing this. I can't imagine doing bioidentical hormone replacement therapy without this constant access to you, my practitioner. I think that it has made it what it is for me. I talk to a lot of women my age who say, oh yeah, I went to a gynecologist, and while they appreciate what I'm going through, sometimes their suggestion is, let's try the patch. And there's not, we've talked about this, there's nothing wrong with that necessarily. But if you are interested in being treated like an individual and optimizing your health based on your symptoms and your health
history,
then it requires a lot more than that. It requires a lot more than a patch. It requires a much more significant analysis of that individual. And that just takes time. And so I think a lot of doctors, especially in the insurance space, they have to they get 15 minutes with you. This is your experience now. And so they aren't able to ask all the questions necessary to flesh this out with the patient. They aren't able to spend the time necessary to look at the blood work in the detail that you do. And then because they aren't able to do that, they just aren't able to acquire the same level of knowledge that you have over the years because they just haven't had the time. So it's not a criticism. It's just why I think that it's so important and why I feel so passionately about offering this service, particularly, obviously, to my peers, but to everyone, and why I think it's a much needed resource in our community.
Yeah, I agree. And I think that that it's a little bit of a learning curve for both the practitioner in a concierge-based practice as well as the patient, because patients are taught to get all of their questions asked and answered within that 7 to 15 minute visit that they have with their doctor, and not really ask for many questions outside of that visit. If they have more than one complaint, typically, like especially with a primary care doctor, if they have more than one complaint, they have to make a separate appointment for those other complaints. So it's not like they have this free flowing of information back and forth where the provider gets to learn about that patient and kind of how they operate and also like how their treatment is affecting them as an individual. But then the patient doesn't have the opportunity to really learn and trust the provider. And so it's a little bit of a learning curve in that in a concierge-based practice, you have that capability. There is no real limit on the number of complaints that you can have per visit. There's, if you leave and then, an hour later, remember, oh, I forgot that one question, you can text me and say, I forgot to ask you this, and you get a real-time answer. And there's this constant back and forth. And then not only do you get to learn to trust me and what I'm doing for you, but I also get to learn more about you and your own personal sensitivities or preferences and things like that. Because hormone replacement therapy, in reference to the patch, like some people, I have patients that just don't remember to take a pill every day. Mm-hmm. So a patch might be a very viable option for them because it's just easy for them to twice a week change this little sticky. Versus having to remember to swallow something every single day. Or a pellet, for example. If they're just really not compliant with an oral medication, a pellet might be a great option because they don't even have to think about it and they just have to make an appointment every 4 months. So it's really important to know all these little idiosyncrasies about the patients individually and help them to live their best life through hormones.
Yeah, so it's not a one-size-fits-all for anyone.
No.
And your approach can't be that way if you want it to be effective, is the bottom line.
Absolutely not. Yeah.
I think one myth about hormone replacement therapy is that it's for old women, which which is so sad because I feel like 50 or, the typical year for a perimenopause or menopausal woman is like so far from old. But I think that's how we thought when we were, in our 30s or in our 20s was like, oh, if you're in menopause, your ship has sailed, know? But it's not true. And I have so many friends that are my age, but also friends that are much younger than me who just don't feel their best, and that's kind of how this journey started for me. I started in my late 30s, early 40s, hormone replacement because I was not feeling my best. I was a young mom. I couldn't keep up with my kids. I was trying to work full time, and that's a lot to take on. But I felt like there was more to life, that there was more potential, right? And when I started exploring this with you, you agreed. There was a lot of levels that testosterone, for example, that was super low, and you felt like there was room to supplement them. So I have friends that are in their early 30s, that have very low testosterone levels, who are kind of just embarking on that time in their lives when they're the most busy, right? And they're trying to establish a foundation for their future, and they just don't feel like they have the energy or motivation to do it. And that's a real thing. This world we live in is very toxic. There's all kinds of things that interrupt our endocrine system. And you've taught me that there is no one that should feel like hormone replacement is not for them. I mean, you might be someone that has incredible genes and, for a variety of reasons doesn't need it. But you can supplement your hormones at any age. That's the truth. And I think that's the first part of it. I think the other part of it is that it's a choice, right? There are so many benefits to hormones replacement metabolically, which I hope you will talk to us today about. And those go well beyond the lifestyle benefits. But if you are someone who is comfortable just living, sort of
coasting along.
Right? Yeah. Or if you haven't experienced significant symptoms such that you feel like something has got to change, that's fine. You're not wrong. You're not bad. Right. It's just if you feel like there is something more to life and you want to approach the second phase of your life beyond menopause with vim and vigor, then it might be something you choose. But it is certainly a choice. It is not something that anyone is forcing you to do. So I think that's an important thing too. I'm personally just starting out. I feel like my life is just beginning, and I don't want to approach the next 50 years of my life feeling fatigued and underwhelmed and sluggish and all these other things that come with an imbalanced system. And that goes beyond hormones, right? It's like all my lifestyle choices impact that, and it's a big undertaking, but it's one I'm willing to do to live amazing, right?
Right. Yeah, I think that this idea that hormone imbalances are only for old people is kind of some information that we've been fed through media and societal norms. And it's actually, like you said, not true. There's no real truth to that because depending on genetics, your environment, and also numerous other things, you can start having hormonal imbalances as young as puberty. I mean, there's any number of things that could go wrong there. And so to exclude someone just because they're a certain age, I feel like isn't fair, to be perfectly honest. So I try to look at everybody with a fresh pair of eyes, no matter what their age, and then just kind of listen to what their symptoms are and see if there's ways that we can help them live better. And again, like you said, it is a choice. Many of the times, because when I see someone and they approach me, their concerns aren't life-threatening. Poor sleep isn't necessarily life-threatening. Anxiety isn't life-threatening. Some weight gain or difficulty losing weight, within reason, isn't life-threatening. But those are all things that could definitely decrease our quality of life. And that's one of those things that I really like to focus on in my practice, is improving that quality of life. But it is interesting when you talk about symptoms, because I recently had a patient that she's in her 60s, and she mostly wanted to start hormone replacement for bone protection, and because she felt like she was putting on a little weight that she felt was hormonal. And so she wanted to explore hormone replacement therapy, and I said, sure. So she was definitely menopausal. We went through over her labs, and we decided to start all 3 hormones: estrogen, progesterone, and testosterone. And within just about 10 days, because she's able to text me as often as she wants, she told me, she's like, I am already feeling a difference. And then within 2 weeks, she said, I did not realize how dull I had become. And I actually feel like I have some life in me now. And so that's where I find it kind of interesting, because there's this group of people that they don't have severe, extreme symptoms that we might hear about, like extreme hot flashes, extreme night sweats, like you're drenching your pajamas and your sheets and all of that. They're not having anything extreme. So they're able to kind of coast through menopause or perimenopause without really realizing these subtle changes that are causing, maybe minute decline over time. And so because it's been so gradual, they don't even realize that they could be better.
Yeah, I think that's a good point too, because we talk a lot about the big symptoms, the hot flashes, the low libido, no muscle mass, weight gain. Those are the ones that you hear all the time on social media and everything, and we talk about a lot. But those aren't all of the symptoms. And you might not experience any of those at all and still want to do hormone replacement therapy for other reasons. Like you said, the bone density. The other thing I've heard you talk about before, which I think is an important one, is that the menopausal state or certain hormone imbalances lead to inflammation. And inflammation is, if you follow, all of these biohackers, they're saying that inflammation is the key thing that leads to disease.
Correct.
And so in a way, it's almost like a preventative measure too. It really is about living and feeling your best, from now into the future. It is not accepting that age comes with dullness or incredible fatigue or, no motivation or disease, exposure to disease, or taking a bunch of pills that are, synthetic meds. It doesn't have to mean that, know. And I realize that a lot of people are sensitive to taking a pill or a patch or, a cream for the rest of their lives. It is a choice, right? I used to feel that way. I was like, I don't want to get testosterone pellets forever. Ultimately, I decided on a different application. But, I thought about that a lot. Do I want to inject myself or use this cream for the rest of my life? And it finally came down to me that when I didn't use it, I didn't feel my best. And so I choose to, right? Yeah. And it's just another part of my routine. But no one's holding a gun to my head forcing me to take hormones. So, it's certainly not for everybody.
No. I think that, so we know there has been research that shows that women after menopause are at greater risk for things like heart disease and stroke and dementia. We know that. And so some of my patients that come to me who want to just prevent, but then they're like apprehensive about taking medicine. I talk to them about, it's this common kind of cliche thing, but you got to choose your hard, right? So it's hard to exercise and make lifestyle modifications and potentially take a pill every day. But it's also hard to suffer from a stroke and have, no use of one side of your body, or your inability to talk, or even comprehend what your family members are telling you. That's also very hard. And so we know that estrogen is linked to the inflammatory changes that cause dementia and heart disease. So if by taking estrogen at an early age, we prevent those things or reduce your risk for developing those things later, then for me, I'm going to take that pill forever. And that's the hard that I'm going to choose over, potentially having a stroke later.
Yeah, I've been thinking about that a lot too. As I age, I've been looking more at women that are in their 60s and 70s and even 80s now, and trying to find someone that I want to,
Emulate
and be like as I age. And it certainly is not someone who has, who is bedridden or who is suffering from hypertension and high cholesterol and all of these things, right? It's someone who is healthy. It's someone who has energy. It's someone who is
active.
That's a huge thing. That's still able to travel. That has maintained the mental clarity to have engaging conversations. That's how I want to look as I age. And if it means taking, estrogen and testosterone for the rest of my life, so be it.
Yeah, I agree. And it's hard because a lot of times, from a practitioner standpoint, from me as a practitioner, from my standpoint, when I look at a patient's labs and I can see kind of the writing on the wall, I can kind of predict by certain markers, like this person's heading down the road of diabetes, which diabetes is a road that leads to dementia and heart attack and stroke ultimately. So if I see that writing on the wall, I might say to them, you may consider hormone replacement. Oh, really? Why would I want to do that? And then I explain to them what I'm seeing on their labs, and they'll say, oh, that's interesting. Well, what would that entail? And then I say, well, it means taking estrogen, progesterone, testosterone. And they say, well, how long would I have to do that for? And I say, well, forever. And they just kind of look at me like, why would I want to do that? So it is a little bit, I don't want to feel like, because it is a choice, I don't want to feel like I'm convincing them, but I do find it very important that to educate the patients what it is I'm seeing and not leave all of that out, and kind of point out those trends that I was talking about earlier that I see when looking at the whole person and the whole blood work all together, and then allowing them to choose, like, okay, well, if the idea of taking a pill every day doesn't make you feel comfortable, then we'll just continue on our way of heading towards diabetes. So, I mean, that sounds horrible, but sometimes that's the choice that people make.
Yeah, I think one of the things that's really different about Halcyon and what you do is that you are going to take the time to go through each and every marker with your patient, and you're going to explain to them, these are the types of symptoms I see with irregularities here. These are the types of things that health benefits you get from an increased level here. You're going to go through all of it, and then you're going to let them choose, like you said. And I know that I have friends who have said that you laid it all out for them, and they said, okay, let me try it. And then they decided, at some point along the line that they didn't want to take this one medication anymore or this one hormone anymore. And so they spoke to you about it. And while you didn't encourage them to stop the medication, you certainly supported that decision. And I think that's really distinct because you want this to be something that they choose for themselves and that they buy into for themselves. It's really crucial in this patient-practitioner relationship.
Yeah.
And I think you really foster that. And so, this one in particular person that I'm talking about, she got off the medication and she started noticing all of these symptoms return. And she's like, Rachel, what do I do? And, you were there for her. You weren't upset with her for making that choice. You were glad that she went through that exercise to decide for herself that this is something that she wants to do. And you're going to do that with all your patients.
Absolutely.
You certainly want people who buy into this and who are willing to take responsibility for their health, because it is not this exercise in optimal living. It goes beyond this relationship that we have with you as a medical practitioner. It is about all of the choices that you make in your life, and you talk about that to your patients quite a bit. And I think it cannot be understated that it is a commitment to your health and to your future.
Absolutely.
And there is a lot of work that goes into it. Exercise, daily mindfulness practices, which that's such an overused term, but things that bring you a sense of calm, your relationships, who you choose to engage in relationships with.
Absolutely.
All of those things require a lot of attention in order to feel balanced. And so I think the fact that you're able to include that as part of the discussion with your patients, it's not just about these 4 or 5 hormones or these other markers on your blood work. It's about how you live your life when you're not here with me. So I think that's a really important part of what you do, because it does support the overall health effort.
I agree. I was just talking to a patient again the other day, and I was talking to him about, because he was kind of looking at me with this like quizzical look on his face, and we were going over all these labs, and I said, listen, this is a partnership, you and I. It's not me telling you what you have to do, but you have to want this. And I'm here to share with you my expertise and my education, and share with you what I see in the data that I get from you, whether it's imaging or labs or whatever, and then share with you what I think would be best to help you either improve these markers or feel better or reverse whatever disease process we might be addressing. And I absolutely believe that, because I can make all the suggestions in the world to you, but if it's not something that you value or that you find important or that you even want, it doesn't go very far.
Yeah, it's not effective.
No, it's really not. I was just thinking, I was trying to think of the term, and I can't think of it at the moment, but there is this phenomenon, and this is why I think partnerships are so important. And it's talking about frequency, and they were talking about how if 2 frequencies come together and are interfered in the middle with each other, so one's heading towards the other, and there's impact there. If they're equal frequencies, they will combine and create one larger frequency.
Interesting.
And they were talking about that in the context of conversation, and how if you are having a conversation with someone that is in alignment with you, then the energy that you are giving to that person and the energy that person is giving to you will combine and create something larger. And I think that that's kind of a great example of what I can see with my patients when we were both on the same wavelength and heading in the same direction.
Yeah. The whole ends up being a lot bigger.
Yeah.
Yeah, that's great.
The overall result is much better.
So my experience with what's interesting, I think, about what you do at Halcyon that is distinct is that there are these main, top 5 symptoms that you hear about all the time in social media and that you often talk about when it comes to hormone imbalances: the low libido, lack of sleep, weight gain, hot flashes, these kinds of things. But there's a ton of other diseases and also symptoms that are driven by imbalances in your body. And yes, we are a hormone replacement clinic. That is that's our driver. But I think it all starts with a baseline review of what an individual is operating in their lives in terms of health and where they want to go in the future. And that might mean hormone replacement, it might not. But your philosophy, your value system is dependent on sitting down with the person and saying, how do you feel about your health? How do you feel about the way you're living your life in terms of your health? And how do you want to move into the future? And then looking at their blood work and combining that with that answer and their symptoms and deciding if they need intervention. But it is not an absolute, right? It is, and I've noticed you've talked about your experiences with patients where they've come to you and you've sat down and you've looked at everything, you've talked about that, and you've said, there's not much we need to do here. But I'm glad you came, and maybe you can talk a little bit about that, about what your approach is to those kinds of patients and why it's so valuable to have that initial baseline discussion and evaluation of their health picture.
Yeah, exactly. I mean, I think that it's really easy to kind of get on a bandwagon and say like, oh, hormones are the cause
answer to everything.
Yes, exactly. They're either like lack of is the cause of, or the more of it is the answer. And it may not be so. Sometimes, like you were saying, I think a lot of it does a little bit depend on age. So I am more likely to offer maybe supplemental support and lifestyle modifications first in someone who is young, because we know, unless there's some kind of genetic or surgical abnormality, that hormones decline as we age. That's just a known fact. So man or woman. And so the older we are, the less, sex hormones we're going to have, the less brain hormones that we're going to have that are going to contribute to our overall well-being. And so most likely, if you're older, there's going to probably be some suggestions I could make there to supplement certain hormones to make you feel better. When you're younger, some of the hormonal imbalances may be just due to the way you're living, and altering that lifestyle could make a huge impact on improving the way your hormones are behaving for you. And so I think that's why sitting down with someone, looking at their overall picture, what kinds of things they're doing from day to day, whether or not they are supporting their body by getting enough sleep or managing their stress or eating the proper diet for their body type, all of those things are going to impact how well the hormones are working, their body's working for them. Because at the end of the day, your body's connected, right? Everything is connected. We're not just the sum of its parts. We are an interactive, dynamic being that changes from day to day. And so it's really important that we keep that in mind when we're approaching the body, and understanding that, like you said, mindfulness is kind of like this overused term, but it goes a long way. And there's all kinds of literature out there that show how mindfulness can affect changes in the body. And it's not just this woo-woo, airy-fairy thing that we suggest. So having that comprehensive individual discussion where we go over all of the things is so important, and knowing whether or not suggesting a hormone replacement is even the best way to approach your particular concern.
Have you had patients that have come to you and said, they're in their early 30s, for example, and they say, I don't really know if it's a hormone thing, or I don't even know if there's anything particularly wrong with me, but I'm just very focused on growing old gracefully. And so I would like for you to look at my blood work and talk to me a little bit about, how I'm living, what kind of symptoms I may or may not be feeling, and then make some recommendations. I mean, do you have those kinds of patients, and what's been your experience with people like that?
Yeah, absolutely. I have had a few actually recently that are young and just want specifically that, but like you said, want to age gracefully, and they are mindful of a lot of things. They may already do some of the like mindfulness practices, journaling, and even some of the biohacking like cold plunge and sauna. But they also want to see how that's relating to what's going on inside their body. And so we'll do the comprehensive blood work to make sure that all of the things that they're doing are in alignment with what's happening in their body. And so a lot of times with those patients, there's not a whole lot I may suggest. It may just be supplements, or, maybe adjusting. Like I had a young woman recently who she actually eats very healthy. She's very mindful of aging, and she exercises regularly. And she just really wants to be as youthful as she can as long as possible. And so we did blood work, and there really wasn't a whole lot that I would have changed. There was a couple of vitamins that I wanted her to add on to optimize those so that her hormones could work best for her, the hormones that she's making. And then interestingly, we found out that she has like a genetic high cholesterol. So despite having a really healthy diet, not being overweight and all of that, her cholesterol was quite high for her age. So we talked about ways that we could manage that without using things like statins, or also doing some more testing to look at whether or not she might be a candidate for a pharmaceutical intervention for her cholesterol. But it was definitely just she said, yeah, I don't really want to take any medications at this point. But I'm open to continuing to monitor that and make sure that I'm, heading down the right path with respect to my heart health. And so it was a really great conversation, and we were able to get some things figured out for her. And then we ended up not really doing much in terms of hormone replacement.
Yeah, I think the point is that was a really valuable thing to her, to have that conversation with you. And I think the other thing that's really important to remember is that, like you said, our bodies are not static. Our health is constantly changing. We know that it is scientifically true that as you age, your hormones will decline. And so while you might not experience any symptoms at 32, that could change when you hit 35. You might not experience anything at 32, but then you have a baby and it changes significantly because babies have a tendency to interrupt our hormone balances.
Absolutely.
And I think that's the other side of it is, what is my baseline? What am I feeling now? How do I want to feel in the future? And even starting that conversation with you as a practitioner early, I think is a super valuable tool. I also thought it was very interesting that hormone supplementation in general can be a preventative measure.
Yes.
So I was telling you that I noticed a drastic change in my the texture of my skin, for example. And you were saying, oh, well, that's directly related to a decline in estrogen. When you start supplementing with estrogen, you're going to notice a dramatic change in that texture.
Yeah.
You cannot reverse aging. I mean, unfortunately, it's inevitable. But that aging process can be far less daunting if you understand how these hormones affect you as you get older. The same is true, I think, after a baby. You have significant declines in your hormones, a lot of the hormones that make you feel good. And, consulting with someone who understands how that works in your body, how they all function together, and explaining that to you, maybe you say, well, I'm okay now. I'm not going to do anything to change. I'm not going to add any supplementation, be it pharmaceutical or otherwise. But when my baby's 2, I'll reevaluate things. The whole point is it's constantly evolving.
Yes.
And, establishing that relationship and undergoing this initial assessment with your practitioner, with you, is super valuable in managing your health long term. And it can change day to day. Sometimes it takes years, but it can change, as frequently as day to day, depending on where you are in that healthcare journey.
Absolutely.
Rachel, you've talked to me a little bit. I mean, I know your history for the last 10 years has been primarily in urology combined with the hormone management. But, you see a lot of urological patients.
Yes.
And you mentioned to me that you've noticed patients coming in with their significant other because they might have an issue that is affecting their significant other. And so the treatment plan that you prescribe is an approach for both of them as opposed to one of them. Can you talk a little bit about that and what your experience has been with couples?
Yes, absolutely. So it's actually been, I've had a few couples for sure. They come in together because they both want to feel, either one came in and started to feel amazing, and then they brought their significant other in to help them feel the same way. But what I do see a lot of, and what I think is important to address, is I work primarily in urogynecology. So I see traditional urologic patients, which is a lot of men, and then a lot of female patients. So, which is unique because not all urology sees women. So a lot of urologists only focus on men. So of course, with all of my experience with hormones, I talk to the women about their menopausal state and things that the ways that I can help them. But on the flip side, I talk to a lot of men about sexual function. And just naturally, it's part of urology. They come in for their Viagra pill. And what's interesting is that there's a lot of men who come in asking for optimization in that particular area. And they may not have any idea whether or not their wife wants to have sex with them. Or can, or if it's comfortable or pleasurable or any of those things. And so I think it's important to know that, like, if you're a female and you're really just focusing on feeling better, one of the things that's going to come with that is an increased libido. And you're going to most likely go to your spouse or partner and say, hey, let's try this out. And they might not be able to perform in the way that you may want. Or they may want. And so I think that knowing that you can both come in to see me so that we can optimize you in that from a sexual standpoint, because that's really where the couples approach comes in. It has to do a lot with sexual health as well as just keeping up with each other. And so knowing that if you're coming in, if you're at an age where you're starting to see sexual dysfunction, most likely your spouse is too, unless you happen to have a much younger spouse. And so it's important to keep that in mind, and then potentially bring them with you when you come in for your consult.
So basically you're saving marriages.
That's one way of putting it.
Yeah.
One sex
that's
life
interesting because, it is interesting if you start feeling great or, if you start performing better and your partner isn't in this, isn't feeling the same, that leads to conflict. And so having, being able to come in as a couple and to approach it as a couple, I think is interesting and something that you do that's different.
Yeah, I think so too. I think more often than not, women come in with consideration to their husbands. Like, I just don't really want to have sex anymore, and it's really affecting my marriage. Mm-hmm. So, and then when they get to a place where they want to have sex again and their body is responding the way they think it should, it definitely changes relationships. So, for sure, I think that it's important to be mindful of who you're going to be having sex with or who you're interacting with day to day, because they may need just as much help as you are asking for.
Yeah, that's interesting.